Good morning, students. In this video, we are going to discuss why exactly we get high volume pulse in pregnancy, right? So let's do a normal pulse first of all. This is our normal pulse. In pregnancy, you are going to get high volume pulse. Shape of the pulse will be normal. There will be a diacrotic notch and diacrotic wave. Everything will be normal, just the volume of the pulse will be more, right? Now, for understanding the concept, why exactly the volume of the pulse is more in pregnancy, we first of all need to understand that what does the volume of the pulse depends on, right? Your volume of the pulse actually depends on pulse pressure. Volume of pulse is directly proportional to pulse pressure, right? As most of you would know that pulse pressure is actually the difference of systolic blood pressure minus diastolic blood pressure, right? Now it's very important to know over here that the systolic blood pressure is directly proportional to stroke volume. That means what's the volume of blood your heart is pumping out with every beat. So your systolic blood pressure is directly proportional to stroke volume. And your diastolic blood pressure is directly proportional to peripheral resistance. Now, let's come back to pregnancy. In pregnancy, which hormone increases? Right? Progesterone. The progesterone hormone increases in pregnancy, and it is actually a vasodilator, right? All the symptoms which you see in pregnancy, be it facial flushing or be it palmar flushing or be it even acid reflux, the lower esophageal sphincter relaxes, due to which the acid regurgitates out, right? So even the acid reflux is because of the effects of progesterone. Okay? So progesterone is a major hormone of pregnancy. So progesterone increases, right? And as we said, that progesterone is a vasodilator. That means it is going to dilate your blood vessels. Now, if your blood vessels get dilated, right, the resistance of the blood flow inside this blood vessels will, of course, decrease, right? If the blood vessels increases in diameter, the resistance to the flow will decrease, right? So, total peripheral resistance will reduce, TPR, in short form I want to write. Total peripheral resistance will reduce. If the total peripheral resistance reduces, then what we said, the diastolic blood pressure is directly proportional to your peripheral resistance. This means your diastolic blood pressure will reduce, right? Your diastolic blood pressure will reduce. Okay? Now coming back to progesterone, right? This progesterone, apart from vasodilating effect, which will further reduce total peripheral resistance and reduce your diastolic blood pressure, apart from reducing total peripheral resistance, it is going to activate the RAS, renin-angiotensin system, right? It is going to activate your RAS, right? If RAS gets activated, that what is going to increase? Your renin is going to increase, right? And what renin is going to do? Renin will convert your angiotensinogen, right? Angiotensinogen to what? Angiotensin 1. Write in short form, I'm writing in short form, angiotensin 1. and this angiotensin 1 will get converted into angiotensin 2 by which enzyme? By ACE, right? And ACE will come from pulmonary endothelial cells, right? Pulmonary endothelial cells will release ACE. Right? Angiotensin 1 will get converted into angiotensin 2. And what this angiotensin 2 will do? This angiotensin 2 will further go to adrenal cortex, right? Let's draw a kidney, and on the top of that adrenal cortex, and what it is going to release? It is going to release aldosterone. And what this aldosterone will do? Aldosterone is going to cause sodium and water retention. It is going to increase your sodium and it will lead to water retention. Now, more water retention means more venous return, right? Your venous return is going to increase. And if venous return increases, then according to Frank-Starling law, now more blood is coming through veins into your ventricles. Frank-Starling law, the ventricles will expand and now the ventricles will forcefully contract. So it will increase the stroke volume, right? And if stroke volume increases, right, it will increase the stroke volume. And if stroke volume increases, what we are going to see? Right? The systolic blood pressure will increase. So in pregnancy, the diastolic blood pressure will decrease and the systolic blood pressure will increase. Systolic blood pressure will increase, diastolic blood pressure will decrease. So the pulse pressure is going to increase and the volume of the pulse is directly proportional to pulse pressure. So volume of the pulse will also increase, right? So in exams, if anyone asks you, right, how exactly you get a high volume pulse in pregnancy, what you're going to tell them, right? That the volume of the pulse is directly proportional to pulse pressure, right? And pulse pressure is the gap between the systolic blood pressure and diastolic blood pressure. Since the progesterone is a vasodilator, it dilates the blood vessel, which reduces the peripheral resistance, so diastolic blood pressure falls, right? And this thing, progesterone is also going to activate your renin-angiotensin system, right? So, which is going to increase the concentration of renin, then angiotensin 1, angiotensin 2. This angiotensin 2 is going to act on your adrenal cortex and release aldosterone. Aldosterone will further lead to sodium and water retention. This will lead to increased venous return. Then Frank-Starling law, the more the ventricle expands, more forcefully it is going to contract. If more forcefully it contracts, it will lead to higher systolic blood pressure. Higher systolic blood pressure, lower diastolic blood pressure, which leads to increased pulse pressure, which in turn leads to increased volume of the pulse. So hopefully this video helped you in understanding why we get high volume pulse in pregnancy. Okay, wish you all the very best. Okay, take care.